This conversation we've titled "Bridging the 3-3 and the 5-5 games." I'm sure you'll remember the 3-3 game is our community capital, building human capital in communities all over the world, and the 5-5 game is the funders, the donor stakeholders, and the liquidity providers and the financial game. So the question I wanted to ask you is, you've been deeply involved in designing the HealthShip approach to communities and funding. How do health protocol scorecards bridge the 3-3, the community game, and the 5-5, the investor funder game?
I'm putting this in my words, Usman. The eureka moment, there have been a number of eureka moments for us on this journey, but the one that really, I think, brought it all together was that moment we realised that just by incentivising that less than 1% of the community to produce the video that we've been asking them to do for months, to produce it in like a week, it just was a eureka moment. And then we realised, right, that them doing that means we activate quicker, which means when we're talking to our investors and our donors, we can actually show that we can activate quicker. And then getting on board earlier is going to enable them to get a greater return on their investment as that activation within the community grows and grows and grows. And you've got this virtuous circle, really. The scorecard, being clear about what we're going to achieve and what the returns look like, is the transparency that builds the trust. And that the greater the trust, the greater relevance and understanding you've got, the more people are going to want to invest. And I agree that the early adoption is really important, but as we all know, it is one thing to create it. It's one thing to lose weight. It's another thing to be able to maintain and keep that off, right? So I think you're going to have investors coming in for the short term and investors coming in for the long term, based upon the value that they want. And you talked about, I think you mentioned earlier on about clinical trials and things like that. Our communities, as an example, offer a much more targeted way to get a better return on establishing those clinical trials. So I think that, I hope I'm answering the question. I think that the scorecard bridge is really the clarity around the objectives that we're looking for, the success and the measures that are going to show us that we're achieving those. And that's how I think it brings the 3-3 and the 5-5 together, right?